Hi, it's Michelle from Movement Lesson, and I was asked a question about hip surgery. Totally get it. Not a doctor. I just play one on TV. No. I'm a movement specialist. That's what I do. I look at movement. One of the things that doctors don't do to take into consideration is they really don't study movement. They study structure. So what that means, on paper, I look just like The Rock. Okay, fine. My proportions are different. That's great. And I'm just using that the extreme analogy is The Rock. He's huge. We have the same body parts. I have a scapula, I have a collarbone, I have a sternum, rib cage. He's done something with his system that's different than mine. And that's all it is. He reacts to movement differently, he reacts to stimuli different. That's all. Each one of us is completely different for that reason. Yes, that free will thing is a kicker, but it's how we react to stimuli. So when a child's delayed, their ability to react to stimuli is just that it. It can't react to stimuli. And with the more and more a child or an infant or baby, and that's where I'm doing right now, about to come out with some big things to do a newborn movement assessment, but to catch the movements, the ability to react to stimuli at a very, very young age and redirect it so that a child is more able. And that's all a movement lesson is. So all I'm doing is I'm touching and working with the system so the system suddenly goes, oh, I can do that. And it does it. That's that. There's no force involved. I keep the system safe. So my question was about hip replacement surgery, and that's why it goes in. Again, it's that reaction to stimuli. So I wish I was better at these videos, more sophisticated to do voiceovers, but watch right now with this. But guess what? Right there, this is her coming over the feet and the knees for pre-crawl. Now, I'm not saying she's going to go crawl today, but that whole rotation is how an infant works. So see, she comes over onto all fours and comes back down. So just being able to do it in sitting is just a precursor. So it's like reading a book. You've got the chapters and so forth. This is just one of her little highlights on her chapters of what's to come. But also, too, you see how nice the feet are? So that she's going over her ankles. Now, at this point, if the ankles were stiff, then this knee would be in more. You'd start seeing more habitual movement patterns. So if the knee was in more, now I would have more time or a harder time rotating that pelvis. Whereas, see, her leg is much freer.
Because there's no place for her belly to go and everything else to go with the knee in the way.
So now we can concentrate just on the ankle and watch how she crosses midline with the back of that ankle going to and from. So she's going to and from with the ankle. If this doesn't happen, she won't be able to side sit. She won't be able to go into, but see right there, she gave it to me. That's a side sit. Again, I'm not looking for her to come over on all fours just yet. I'm looking for her proportions and how she's doing the sitting. So what you're watching or seeing that is, it just, even at 6 months of age, do you see in what I mentioned, she's learning how to have her proportions, and her proportions meaning, so if I go like this, I know where my knee is here, my foot here, all of this. These are all proportions that I know. Obviously, every time I do examples, my right foot goes up, my left foot's a standing foot. Now, I play with it because I do karate and all that, so I can do it. I don't stand on my right foot as well as my left. So if I have to do something, especially for show, I'm going to do what my system knows. I know how to react to stimuli in a certain way. And the reason some people are more elite, because their ability to react to stimuli from the left and from the right gets more and more neutral, more and more, and that's what people consider perfection. So if I'm an amazing tennis player or basketball player, I can react to that ball in this way just as well as I can this way. So, and that brings them up to an elite status. Yes, there's more involved with that, I get it. So my concern is, I realize in cases the hip has to be replaced, but this is something to take into consideration. You have to look at where the new hip is going. So in a munchkin, what kind of hip is being replaced? Is it a mechanical one? So can that system grow with it? Or is that system going to need future hip surgeries? That's a good question. As the system grows, because that's what we do, we grow. But also look at, now here, my iPad. look at the hip. We are developed, made a certain way for a reason. Yes, we get fatter, heavier, short, wide, I get that. But look at the overall mathematics and structure. So your hip joint is actually coming in to the side here with the pelvis, right? But if you notice it, off of the trichanter, it's an angle. And that's the mathematics of standing. So if you change that, and this is a really interesting thing that you can do on your own. So just look at the way you walk. So when you walk, just feel the way that you present from the left foot off of the right, and do the right foot off of the left. Now, a lot of you have never probably done this before. You might feel differences. So, and this is what happens to some of my kiddos. Hip joint, let's say, is more so here. And again, if you're not familiar with that, look for the crease, and just feel that. So I want you to just put your fingers right there in that crease. And again, take a step forward. So now I'm going to ask you to take this finger and just put it in up like about 1/4 of an inch. Just let's say to here. Immediately you'll start seeing, and this is what happens with a lot of kids. Notice here, right where my seam is, I walk forward. The second I go up just a little bit, my system now rotates. Do you see the difference? So look at the way I'm starting to rotate to bring that foot out. So here, I go right forward. And now as the hip goes farther, like I have one kiddo, it's all the way up in the iliac crest. So just going like something like this, actually his knee has to come. There's no way of stretching that leg out anymore. And I have a whole other video on him. But so, and that's because he's had now 3 hip replacements. They couldn't do this anymore, so they had to go up. I've had people, because this hip goes up, they make this leg now shorter, so the legs matches up. I'm telling you, these scenarios go on that people don't think about it until it's too late. And I just want to take those into consideration. So just feel the way, like I said, you go forward. And just changing, even if the hip is in the exact same place. Let's say it's now a mechanical hip. What my bones, when I stand, what my bones can do now versus something that's mechanical. The brain is used to the old hip. So those all have to take into consideration whether to or not do surgery. But if the CP is that bad, where it's causing the hip dysplasia, it's pulling out the hips, it's never formed. But the argument too of putting these kiddos in a stander, no. That's where again, you need to show that foundation of going through like this versus just standing, to putting pressure. The pressure comes always through a rotation through our system. And that's the most efficient way, and that's how we move. Everything is through rotation. So if that rotation gets changed. So again, you really want to ask a lot of questions, specifically in structure and how it affects movement. Because, trust me, I can take a lot of people, they look good on paper, they look good in an x-ray. You're just standing here, I get that. But the living central nervous system has issues, has glitches, has developmental delays. I've got kiddos profoundly challenged, and the MRI is fine. So it's not always about, well, the file looks, and I got this all the time with my son. If you actually looked at his file versus him, what a difference. Well, yeah, he's had a lot of work done with him, but he has complexities. He's had autoimmune failure. I can't change that. I can work around it, but I can't change some things. You can't always cure everything, but you can live here with something or live here with something. So I know I'm getting a little off subject here, but that's something to consider with the hip. Oh, now that I'm doing that. Also consider here. See again, most people think that walking is I take a step out and go up over onto the foot. But really what it is, I'm balancing on the one foot as it comes out, but it's more so, and you see me all the time at the pelvis, but it's your system coming over the system. This happens from my hand to here, my head to here. It happens throughout our body where we should be able to come even here. My lungs, the way it comes over our system. And that's something also to consider with the hip surgery and what's going to happen with your child. So just look at the way your child's moving or you're moving before you make these decisions, and then just notice how your life would be better. You look for the wow factor, or your life might not be great because it was done. And that's where you hear that people, yes, have had surgeries and they're, quote, unsuccessful because someone didn't consider the movement of the structure. It's not that the surgery was bad. They didn't consider the movement of the structure. And that's where I'm a little different. I'm always after the movement. I don't care what you look like on paper. I really don't care what the diagnosis is. I'm looking for the efficiency of the structure, how it reacts to movement, how it reacts to stimuli. That's all we are for development. Thanks.